The federal government is buying millions of doses of Pfizer's antiviral drug to make it more accessible to those with COVID.
Here at home, Erie County is offering the pill to people who test positive and who are ill with symptoms. Joining us now live to talk more about this is infectious disease expert Dr. Nancy Nielson from the Jacobs School of Medicine at UB. Dr. Nielson, thanks again for joining us.
My pleasure.
All right, so let's talk about how this pill came to be. Of course, the federal government buying millions of doses. Erie County will help to distribute it. Give us the background on what this pill is and what it treats.
Well, this is actually two pills. What's called Paxlovid is actually two different pills. One stops the coronavirus from replicating, and the other one helps to keep the first pill from breaking down too quickly. So you take these twice a day. You take 2 of one and 1 of the other. So you take 3 pills twice a day for 5 days. And this actually has been shown to reduce the risk of hospitalization and death by almost 90%. It's really a stunning breakthrough in our treatment of COVID.
Now, I remember we talked about this with you in the past about these antiviral treatments. Now, really, how helpful do you think that it's here in our area that our residents have access to these pills and these treatments?
Well, it's critical. I think there has been a lot of confusion. First of all, people didn't know what pharmacies had Paxlovid available. Some doctors wondered if it was safe to prescribe because you have to be careful. You have to be careful about people who have kidney disease or liver disease, and there are some drug-drug interactions. So it's not something that should be given over the counter, but it is a safe drug. And when used, drug combination, when used as directed, and it really is important. Very important to remember, you have to take it within 3 to 5 days of the onset of symptoms and a positive COVID test. So you have to have a positive COVID test, and it can't be more than 3 to 5 days since your symptoms started. Otherwise, it's not going to work, but it is astonishingly effective. We also are now having the availability of testing the same drug in children. It's not approved for children at the present time, but UB is one of 55 sites in about 5 countries that are testing it in kids 12 to 17. So this would be reserved for somebody who had an underlying condition, something like diabetes, sickle cell, that sort of thing. But that is available now on an experimental basis.
What's the expectation on distribution here? We're also talking about people, this is available for people with symptoms, so they have to be symptomatic, particularly right now, depending on the variant that you get, you may or may not have symptoms. So do you need to be at a hospital or do you need to be at a medical facility in order to receive this? Or you mentioned a pharmacy just a couple of minutes ago.
Absolutely. This is an outpatient drug. That's what's so great about it. We have another drug, remdesivir, that is used for people who are also at risk, but it requires IVs. So this Paxlovid is oral. So 6 pills a day for 5 days, and that's the end of it. It's really quite convenient. You can get it wherever your doctor calls the prescription in, whether that's a pharmacy or an urgent care center, for example, or your doctor's office. For example, Erie County Health Department announced this week that their testing sites are going to be able to give the prescription right away. So these are called test to treat sites. So check with Erie County for that.
All right. Excellent. There's a lot more information that we have about this pill and its distribution available on our website, wyvb.com. Dr. Nancy Nielson, thank you so much for joining us.
My pleasure.